Football Injuries by Ryan Smith. My main purpose is to inform you, the people, of injuries in football. First, traumatic injuries. Traumatic injuries can be very serious and very hard to overcome. Become an Advocate for Sports Safety states that knee injuries in football are the most common. Examples of knee injuries are ACL, PCL, and meniscus tears. An ACL tear can take 3 to 6 months to overcome. In past, a ACL tear was career-ending for a football player, but in today's time, with the technology and rehab recovery, a player can be back to playing within 3 to 6 months. Examples of shoulder injuries are labrum and acrovestibular joint, otherwise known as ACJ. Second is concussions. A concussion is change in mental state due to a traumatic impact. In past, concussions weren't as relevant as they are in today's game. To be cleared to play after suffering a concussion, one must pass a computerized test. According to concussions, immediate effects of a concussion may be dizziness, headaches, blurred vision, coma, or seizures. But more long-term effects can emerge, including memory problems, lack of inhibition, intense anger and/or aggression, personality changes, inattention and lack of concentration, problems organizing, planning, and problem solving, and language impairment. Third is heat injuries. Dehydration is the main cause of heat injuries. Dehydration can lead to heat cramps, heat exhaustion, and heat stroke. If suffered from a heat injury, players must have to be hooked up to an IV to replace vital fluids they have lost. Heat injuries and heat exhaustion, OrthoInfo AAOS states that when we exercise, our bodies cool off by sweating. As we perspire, we lose necessary body fluids. If we do not replace these fluids, we become dehydrated. This makes it difficult to sweat and cool down, which can result in a heat injury. According to 81 voluntary chronic dehydration in adolescent American football players, heat stroke is a medical emergency which can lead to death and is usually associated with hypovolemic shock and extreme hypothermia. Football injuries. In conclusion, football injuries can be very serious and do not need to be taken lightly. Some of these injuries, if not treated, can lead to death.